Tibialis anterior originates at the lateral condyle and proximal half of the lateral surface of the tibia, interosseous membrane, and deep fascia and lateral intermuscular septum. It inserts on the medial and plantar surface of the medial cuneiform bone and base of the first metatarsal bone. When you manual muscle test the tibialis anterior, you want to make sure your patient is seated with their knees flexed. Place your hands above and below the ankle joint and have your patient dorsiflex and invert the foot. Then after you test one side, you want to test the other side and perform the same motion. These would both receive a 5 out of 5. A compensation you should be looking for in this test is any extra scooping motion of the ankle or the patient is excessively lifting their leg off the table. The tibialis posterior originates on most of the interosseous membrane, lateral portion of the posterior surface of the tibia, proximal 2/3 of the medial surface of fibula, adjacent intermuscular septa, and deep fascia. It inserts on the tuberosity of the navicular bone by the fibrous expansions to the cystinoculum tali, 3 cuneiforms, cuboid, and bases of the 2nd through 4th metatarsal bones. When you manual muscle test the tibialis posterior, your patient is supine and they are laying down or seated. Your hands are going to be placed above and below the ankle joint and your patient is going to plantar flex and invert their foot. You are then going to test your patient on the other side of the leg and have them perform the same motion. I would give both these legs a 5 out of 5. Some compensations you should be looking for while testing are an extra scooping motion of the feet.